Today I'll be talking about diabetic foot ulcers. What is diabetic foot ulcer? Always this question comes first. Person thinks that diabetes means diabetic foot ulcer is common. Yes. This starts with a small ulcer or the small cut in the foot, and then in diabetic patients, mainly because of this many years of diabetes, their skin becomes much more numb. They don't feel that pain, and because of diabetes they are prone for infection. Initially small cut will become bigger, and that it becomes infected. Then only person will realize that there is something wound or cut on the foot, and once they realize, at that time it has already become big. So in my 20 years experience, I can say that diabetic foot ulcer, it is not a big problem, but it is a small thing which becomes much more bigger, and it ruins person's life or livelihood also. Why? Because a simple diabetic foot ulcer can become much bigger, which can lead to the toe amputation, and occasionally we have seen that major amputations also can happen. Now it becomes more complicated. Why? Because in diabetic foot ulcer, if there is a lack of circulation, or you can say there is a problem with the blood supply because of the age and other things, then this wound healing will be much more delayed and it will not heal, and that leads to wet gangrene and other problems. That's why diabetic foot ulcer should be considered as a very serious problem. You should inspect your foot every time. That is there a small hard skin or a small break in the skin, then you should clean it properly. And if you see any color change, redness, increase or decreased temperature of the foot, these are the all symptoms you should be looking for. If it is there, contact your nearby healthcare person or a vascular doctor and get it checked. This is utmost important.